Hello, it's Lindsay from the UK Hypnosis Convention again. Today I'm with Garry Coles. His presentation, which is on Sunday 11:45 till 12:45 in the Windsor Room, is entitled The Cancer Journey Hypnotic Interventions. Garry has 5 busy practices. He's consulted for over 14 years at a major UK hospital, specialising in oncology-based hypnotherapy work. And he carried out the first UK-based research into the effects of pre-surgical hypnosis on the recovery quality in breast cancer operations. Welcome, Garry.
Thank you, Lindsay. Thanks. It's nice to talk to you.
And you. Last time I think we were actually at the convention enjoying dinner together, weren't we?
Yeah, it was indeed, yes.
Can you tell us a little bit more about yourself and what we can learn from your presentation?
In a nutshell, my background is oncology with hypnotherapy. That was a little bit by accident, to be honest. I qualified as a hypnotherapist originally, decided I needed to get experience, and the only way you could get experience, obviously, was seeing clients and patients. Yep. Out of the blue, I was asked by a local hospital, would I come and do some work with some cancer patients? And I thought, yeah, I'll go in there for a couple of weeks, get experience and disappear. And now over 14 years later, I still haven't disappeared. I'm still there. I've now worked with over 2,000 cancer patients. So over the years, I've managed to develop particular techniques, particular approaches that I find works with them very well. And in fact, things have sort of gone full circle, really. I got badgered a few years ago. Once I started coming to the conventions, I started getting invited to conventions all over the world. So I've already been to New York and Las Vegas this year. And then somebody suggested that I put together training courses for hypnotherapists in hypno-oncology. So I thought nobody would be interested, and I was rather wrong, because they sell out pretty quickly. I've just come back from teaching in Bahrain. I've just come back from teaching in Las Vegas. For anybody that's interested, I will be teaching my last UK one this weekend in Chester. If anybody'd like to put a note on the bottom, we still have a couple of places left. So that's the last one in this country planned. I got involved in oncology, and then when I did my master's degree, so I'm one of a handful of people in the UK with a master's degree in clinical hypnosis, and I decided when I did my thesis and research, I wanted to make it really difficult for myself, and I decided I wanted to do medical research. So as you mentioned earlier, I actually did some research into pre-surgical hypnosis and the effects that has on the recovery quality in breast cancer operations. And I was able to demonstrate that it did have a positive effect. We had a fast recovery quality, we had less pain perceptions, and psychologically they improve much faster. They come back up from being depressed to essentially the norm, sort of the public norm, whereas the control group didn't. So we were able to demonstrate that. As I mentioned, I've developed a lot of approaches and techniques, and because I think this is going to be the very biggest area. Certainly, a lot of people don't realise statistically, 1 in 2 people born since 1960 will actually suffer from cancer. That's 50%. Yeah, it's about 1 in 7 women get breast cancer, 1 in 8 men get prostate cancer, 1 in 15 develop lung cancer. It's quite frightening, but yeah, 1 in 2 will be affected. So everybody, if they're not affected, their partner or mother, father, children, friends. And I get a lot of hypnotherapists, very experienced hypnotherapists, that sort of know that I do this work. And they phone me up or email me saying, but I've got a friend or my partner or somebody going through the cancer journey. What do I do? And it's one of those things that hits them. They're perfectly qualified, perfectly experienced, but it just hits them. They don't know what to do. And that's where I've sort of come in with all the techniques and approaches. And that's what I teach on my courses, which are either 1 or 2 day. But I'm going to distill that down into an hour at the UK convention on what sort of things that you can actually work with cancer, and bearing in mind what you need to consider ethically and legally, because it is a bit of a minefield. There is a 1939 Cancer Act, which a lot of people wouldn't realise.
Yeah, I don't think people do realise that, and it is still on the statute, isn't it? Whereas
it is still on the statute, and there's a lot of things that you could get into an awful lot of trouble for saying, whether it's in conversation over a telephone, let alone sort of putting it on the internet or on your website. That can cause a lot of problems.
Just to say that is in the UK, not I don't know about other people's laws.
No, it is in the UK. There are ethics legislations in the US. In other countries, it's quite frightening. I mean, one of the things that astounded me when I was teaching recently in Bahrain is I was talking about insurance and, you know, and the legal and ethical issues. And despite the fact that they're now using hypnotherapy with cancer patients in Bahrain, Bahrain doesn't recognise hypnotherapy as such. They've only recognised psychotherapy for a couple of years, and therefore it's not even possible for them to get liability insurance. All the practitioners in Bahrain, worryingly, are practicing from an uninsured position because it's just not possible to do in Bahrain.
Goodness, yeah.
Which I was quite gobsmacked by, to be honest. But
Yes.
but that's the way it is. So so the idea really is to look at the ethics, and there is a good place for the ethics, because unfortunately on Facebook groups I see so many people preying on the desperate, offering all sorts of snake oil cures, and I see it in hospital where people say, I'm going to Switzerland next week or Germany next week. It's costing me X thousands of pounds, but there's a chance they might be able to do something. And generally, they're just taking the money.
Taking the money.
So certainly, I'm looking at it from a very ethical point of view. It's for the cancer journey. We don't treat cancer. We don't work with the cancer itself, because that would be illegal. However, one of the other things that I do cover in the talk is there is a lot of experimental work that we can legally do that may have an impact. For example, what the talk I did last year, which leads into this, was on psychoneuroimmunology at PNI. And there's a lot of research coming into that area that could well have an impact with hypnotherapy in the cancer arena. So again, we'll touch on that as part of the talk.
That's really interesting. Do you think it's one of the subjects that people, hypnotherapists, hypnosis professionals, are a little bit frightened of working with, perhaps? Because
I think they are. And again, I think it's because, as I mentioned, I get hypnotherapists that phone me up who are very well qualified, very well experienced, and they've suddenly got somebody close to them diagnosed, and they've got no idea what they can do.
Yes.
And because of that, you know, I think the word cancer is very emotive, and people tend to panic. People don't know how to communicate with people once the word cancer is mentioned, and that's a big impact on how you just even communicate with people going through the cancer journey. People are frightened; they might say the wrong thing, or don't know what to ask or what to say. So those are all big things which do have an impact, I think. With things, but it is something that we need to look at, because I mentioned one in two will develop cancer, so that's 50% of the population. Out of that, interestingly enough, 40% of people with cancer actually seek out complementary therapies.
That's much higher than I thought, actually.
Yeah. So therefore, you've got essentially 20% of the population will be looking for complementary therapy. So if you get that percentage will get cancer, that percentage looking for complementary therapies, that's 20% of the population could be looking for hypnotherapists who can deal with cancer patients.
That's amazing. Well, my sister had breast cancer. She's very well now. She's completely recovered. But my goodness, she was angry. That
anger is a very, very big part of it. The why me syndrome.
Yeah, it was amazing. She's fairly placid, but my goodness, that anger was just really boiling, which can't help, can it?
No, it doesn't. And because again, the more anger you get, the more stressful you get, possibly even depressed, and of course that's starting to have an impact on your immune system, which again is not helping you going through the journey.
Yeah, exactly.
So these are all things we can assist in addressing.
Yeah.
And also hypnotherapy is very good. Obviously, we know we can do pain control and things like that with hypnotherapy, but it's actually very useful to deal with a lot of the side effects of treatment, because the most common treatments, radiotherapy, chemotherapy, they come with a lot of side effects that we, as hypnotherapists, we can help the person through, because although a lot of it is physical, because it is affecting the body, there is a big self-fulfilling prophecy there, because you're told by the surgeon or the specialist that you will feel this will happen, that will happen. Of course, it's the self-fulfilling prophecy. I was told that will happen, so it is.
Yes.
And I think there's I'm pretty sure there's a huge psychological element behind that.
I'm sure
which again we can address with hypnotherapy.
Yeah, excellent. That sounds so interesting. It really is, and taking the fear from us as professionals working away with it, I think is really important. It's really important.
It is. I mean, there are some pitfalls as well, which again we do discuss, because obviously if you're going to work with somebody that isn't just sort of family, if you're doing it sort of as I do in a hospital and things, unfortunately the prognosis is not good in a percentage of people. So you do have to deal with the fact that you will lose patients. You will come up with relationships and you will lose them. So it can be difficult for a lot of therapists to work with. I've seen many therapists in the hospital that are very well meaning, they want to get involved, and help, and they last a couple of weeks because
Yeah.
they get in that environment and find that they just can't cope with it emotionally.
Yeah, yeah. Thank you so much, Garry. So, well, your presentation is on the Sunday, 11:45 till 12:45 in the Windsor room.
Excellent.
So, I think that might be the room you were in before last year, but I can't remember.
I honestly can't remember. It was a long time. I've been into a lot of rooms lecturing since then.
A lot of places since then. Exactly.
Yeah.
It will be very well signposted. So that's the Windsor room, Sunday, which is the 10th, 11:45 to 12:45. Garry, thank you so much.
That's excellent. Thank you. And again, just a quick reminder, if anybody'd like to do the whole day of it, just rather than an hour, I will be in Chester this weekend for the last one this Saturday.
Great.
So if anybody
Look forward to seeing you, and enjoying a cup of coffee, dinner together, or whatever.
There may be the odd alcoholic beverage involved. I believe it was last year.
See you then, Garry.
All right. Thanks very much, Lindsay. Take care. Bye-bye.
Bye.
Bye.